We're here today at the RVH launching Sinn Fein's Health Manifesto. There's no doubt there's many challenges in the health service and we want to tackle those in partnership with trade unions, with staff and with patients. We think that can be done in a positive manner in the incoming term. We've highlighted a number of issues which Sinn Fein are passionate about, and one of the biggest issues for us is rebalancing the spend on public health and on preventative work. The public health agenda has been neglected in the last 4 years by Michael Ramsey. We've had 1.6% spend of the entire health budget on public health. That's not sufficient if we're going to seriously tackle health inequalities and create more positive outcomes for people who need the health service.
Sinn Fein are clear. Our record has shown that we're against privatisation, and I want to send out a clear message now. If there is good things in any of these consultants' reports, let's see them. You see the bad things, they'll be binned to history. They'll be put in the bin. We'll be here. We've been with the service users. We've been with patients. We've been with staff. We've been with them every step of the way. We're not going to stand over anybody that's going to come in and privatise a health service or charge anybody to go and see their doctor or for an X-ray. Health is free. It should be free, and it will continue to be free.
The island of Ireland is a small island and we must maximise health services for all right across that island. The fact that we're running two health systems back to back here is an absolute waste of money. What we need to see is more working together. There's a North-South feasibility study which has been sitting on Mike Ramsey's table for the last 2 years. Sinn Fein want to see that proposed, and we want to move forward positively and bring forward those recommendations that will work for everybody who lives in this island in terms of healthcare.
Well, I mean, we're in the constituency of West Belfast today, which has a high level of mental health issues, which has a high level of suicide and self-harm. It's something that we as a party have campaigned on for a long time. I'm actually highly disappointed and annoyed at the attitude of the Health Minister and the Health Department in targeting and tackling the whole issues of suicide and suicide prevention and mental health issues. What we'll be doing is we'll be ensuring through our involvement in the executive, and myself and my colleagues recently met with the OFM, DFM, and pushed to ensure that suicide and suicide prevention is an executive issue, and that's something we will continue to do, and we'll be pushing at all levels that resources are in there at a ground level, resources are there throughout people's life if needed, and that we're in to prevent. And the point that Michelle made earlier about public health, we need to get in there and resource public health so that we can actually go down the road of preventing some of these issues of ill health later on in life.
Sinn Fein have a proven track record in standing up for the health service and in standing up for frontline services. On the May the 5th, people have the opportunity to place their vote for Sinn Fein. A vote for Sinn Fein is a vote for a positive health service.